Autism Spectrum Disorder (ASD) is a neurodevelopmental condition characterized by differences in communication, social interaction, and behavior. One of the hallmark features of ASD is the presence of repetitive behaviors and intense, focused interests, which can sometimes manifest as obsessive behaviors. Obsessive behaviors in ASD. Individuals with ASD often engage in behaviors that resemble obsessive-compulsive tendencies, but these behaviors are usually driven by different underlying mechanisms compared to obsessive-compulsive disorder (OCD). Some common forms of obsessive behaviors in ASD include 1. Repetitive movements, stereotypies. Hand flapping, rocking, spinning, or echolalia, repeating words or phrases. 2. Intense, narrow interests. Deep fascination with specific topics, e.g., trains, space, historical events. 3. Need for routine and sameness. Strong preference for consistency in daily activities, meals, or environments. Distress when routines are disrupted. 4. Perseveration. Repeatedly talking about or thinking about a specific topic, often to the exclusion of other activities. 5. Sensory-based fixations. Fascination with certain textures, sounds, or visual patterns. ASD versus OCD. Key differences. While obsessive behaviors in ASD may resemble obsessive-compulsive disorder, OCD, the key differences include motivation. In OCD, compulsions arise from intrusive, anxiety-driven thoughts. In ASD, repetitive behaviors are often soothing, enjoyable, or part of a rigid routine. Awareness and distress. People with OCD often recognize that their compulsions are irrational and want to stop. People with ASD may not see their behaviors as problematic and may resist change. Response to interruption. In OCD, stopping a compulsion causes extreme anxiety. In ASD, disruptions to routines can cause distress but may not involve the same anxiety patterns seen in OCD. Managing obsessive behaviors in ASD. If obsessive behaviors interfere with daily life, strategies can help. 1. Structured schedules. Predictability can reduce distress. 2. Gradual changes. Slowly introducing flexibility into routines can help with adaptability. 3. Alternative outlets. Encouraging engagement in related activities can provide balance. 4. Cognitive behavioral therapy, CBT, modified CBT can help with anxiety-driven behaviors. 5. Sensory support. If behaviors are linked to sensory needs, tailored sensory activities may help. Sensory support refers to strategies and tools used to help individuals with sensory processing differences, common in Autism Spectrum Disorder (ASD), manage their responses to sensory input. Many autistic individuals experience sensory sensitivities, either heightened or reduced responses, to sounds, lights, textures, and other environmental stimuli. Sensory support helps create a more comfortable and functional environment by addressing these sensitivities. Types of sensory support. 1. Sensory-friendly environments. Reducing bright lights, loud noises, or strong smells. Providing quiet spaces for relaxation. Using soft, neutral-colored decor to minimize visual overstimulation. 2. Sensory tools and equipment. Weighted blankets or vests help with calming and body awareness. Fidget toys help with focus and self-regulation. Noise-canceling headphones reduce overwhelming background sounds. Chewable jewelry helps with oral sensory needs. 3. Deep pressure and proprioceptive input. Activities like squeezing a stress ball, hugging a pillow, or deep pressure massage can help calm the nervous system. Heavy work activities pushing, pulling, carrying weighted objects can regulate sensory input. 4. Movement-based support, vestibular input. Swings, trampolines, balance boards, or rocking chairs help individuals who seek movement. 5. Tactile sensory strategies. Access to preferred textures, e.g., soft fabrics, textured toys. Avoiding clothing tags, scratchy materials, or tight-fitting items if they cause discomfort. 6. Visual and auditory support. Dimmed lighting or blue light filters to reduce sensory overload. Visual schedules or timers to aid in transitions. Calm background music, if helpful, or white noise machines. 7. Olfactory, smell, support. Using neutral or preferred scents. Avoiding strong perfumes, cleaning chemicals, or foods with strong smells. How sensory support helps with obsessive behaviors. Many repetitive or obsessive behaviors in ASD are linked to sensory processing differences. Providing appropriate sensory support can reduce anxiety and self-stimulatory behaviors, e.g., rocking, hand flapping. Improve focus and attention by minimizing sensory distractions. Enhance emotional regulation by creating a comfortable sensory environment. Enhancing emotional regulation in individuals with Autism Spectrum Disorder, ASD, involves helping them recognize, understand, and manage their emotions effectively. Many autistic individuals experience intense emotions and may struggle with self-regulation due to sensory sensitivities, difficulties with communication, or rigid thinking patterns. Here are several strategies to support emotional regulation. 1. Recognizing and labeling emotions. Emotion charts and visual aids. Use emotion charts, color-coded zones, e.g., zones of regulation, or facial expression cards to help identify emotions. Modeling and naming emotions. Adults can label emotions in real time, e.g., I see you're frustrated because your toy isn't working. Social stories and scripts. Create short stories or scripts that explain emotions and how to respond to them. 2. Sensory regulation strategies. Since sensory overload often leads to emotional dysregulation, providing sensory support can help. Calming sensory input. Weighted blankets, deep pressure, fidget toys, or noise-canceling headphones. Movement-based regulation. Swinging, jumping on a trampoline, or engaging in yoga, stretching. Reducing overstimulation. Providing quiet spaces, dim lighting, or predictable routines. 3. Teaching coping skills. Deep breathing techniques. Simple breathing exercises like, smell the flower, blow out the candle. Progressive muscle relaxation. Tensing and relaxing different muscle groups. Mindfulness and grounding techniques. Focusing on the 5 senses: what do you see, hear, smell, taste, and touch. Self-regulation tools. Offering stress balls, chewable jewelry, or comfort objects. 4. Supporting predictability and routine. Visual schedules. Providing clear schedules with pictures or written steps. Timers and transition warnings. Giving advance notice before changing activities. Social narratives. Using short stories to explain changes in routine or expected behaviors. 5. Encouraging emotional expression in safe ways. Journaling or drawing. Encouraging writing, drawing, or using emotion charts. Safe physical outlets. Activities like punching a pillow, jumping, or using a sensory swing. Alternative communication. Using AAC devices, sign language, or visual cards for nonverbal individuals. 6. Building cognitive flexibility and problem-solving skills. Perspective-taking activities. Role-playing different viewpoints in social situations. Flexible thinking games. Activities that encourage adapting to change, e.g., changing rules in a game. Choice making. offering controlled choices to increase a sense of control. 7. Emotional coaching and support. Co-regulation first. Before expecting self-regulation, caregivers can model calm behavior and offer reassurance. Safe emotional outlets. Teaching that emotions are valid and should be expressed in safe, constructive ways. Rewarding positive coping strategies. Reinforcing successful self-regulation with praise or small rewards.